this is your before. I'll show you the date, 10/3, okay, and this is 10/11. So it's 1 week after the procedure. So we're going to first go through this. So this was when you did the upper jaw advancement back in London 10 years ago.
Right.
And that's your current scenario when you came to us. And we've done what is called as a revision upper jaw and a bi-jaw.
Yeah.
Revision upper jaw, bi-jaw, okay? Now this is what we are right now. So you can very clearly see, I'm just going to show you a little bit things first up, then we go to the measurement part. But just with the naked eye, when you see, you can see this, just look at this tooth now.
Yeah,
There's a gap here, and there's no gap.
Definitely.
So 5 mm come forward. Like that, everything I'll tell you one by one. Then you see this gap, this distance from this screw to there,
Yeah.
it's less. Then the bend, these are different plates. You can see that.
Yeah.
So we've taken these off, and I told you I'm going to use the same cut.
Right. Yeah.
So we use the same cut, and we've advanced it further. And this advancement, what we planned was 5 millimeters.
Right.
All right. And then concomitant advancement of the lower jaw. Now again, how do you see the lower jaw? I'm going to show you. There's a slight gap there on one side, but that's going to heal up. Now the important thing you have to notice is there are 2 screws here, 2 screws there, 2 screws here, 2 screws there. So you still have to be careful in the sense not go and eat some heavy food, because if you eat that, then the bone can move and cause some problems. So I expect you to be on liquids, semi-solids and everything for 4 weeks after a bi-jaw. Okay, now I'm going to show you similar thing from this side. Again, you can see, let me get some.
This would be my left, right?
This is your left side, and this is the later one.
Turn, yeah. What you did, yeah, that way, turn. Yeah. So, yeah, I can really appreciate the advancement.
Yeah, you can see
So
that.
obviously, in the past, when I first had my surgery, there was a 6 millimeter advancement. So now, obviously, the total would be 11, right?
Yes.
Okay. Just wanted to make sure.
Yes.
You didn't set it back and.
Yeah.
You just can't. You work from what you know.
Yeah, I work from where it was left
where it was.
before.
Okay, that's sweet.
Yeah, and then I'm going to show you now. We'll go on to the measurement part. So again, it's a similar cuts. So we can show you the so the plates are appearing there. Why I'm showing you this is because if you see carefully here, I think you can appreciate it. There's a cut here, there's a cut here, right? Can you see that?
I mean, it's quite hard to.
Yeah, I show you. So this is the cut on the upper jaw.
Right. Okay.
This bone was there.
Right.
Can you see that?
Yeah, I can see the difference.
So we can measure that now. See that?
Right. Yeah.
So that's 6, the original
6 and the
whatever you had, and then the now 5.
Yeah. So that's just over a centimeter, really. In total.
Yeah. But that's over the 2 surgeries that you've had.
Yeah.
The first surgery was 6 mm, and now we've done 5 mm. So we've just, so because it's a good 10-year lapse, so there was good healing from your first surgery, and so I don't expect any issue with relapse. It's going to be as good as we doing it for the first time, even though it's a revision. All right.
Yeah.
Then I'm going to show you some other views where you can again appreciate. So these are the axial cut sections, and this is the one on the left is before.
Is this from the bird's eye view angle?
No, this is like this.
Right.
We're sectioning, we're going up, then I'm going to go down and show you the mandible too. I'm trying to show the cut on the lower jaw in this. Can you see that?
Yeah, I can see it. Yeah.
You can see that?
Yeah.
And there's no cut there because you don't have any lower jaw procedure. I'm also trying to show you the cut to show that we've only got the outer cortex, so the nerve is intact. It's that clear. You can see everything. It's not something that you have to guess.
I could already feel the numbness going away.
Wow, that's awesome. So soon? Okay.
I would say about 20% improvement since yesterday. So
Cool. It's going to improve continuously till you're going to feel normal, maybe in a few weeks' time. But anyway, I'm just showing you the entire cut, which was not there before, just so that you appreciate that it's a sagittal cut. And by the way, all of these scans are there with you.
Okay.
You're going to have both of them.
Right.
You may not be able to compare on your software, but you may not be able to measure it out, but you still have all the details with you. So for future reference, for anything, keep it safe. Because in case, a surgeon in London wants to see what was done like 1 or 2 or 4 years later, this is something they can really fall back onto. All right, that's the thing. And
no, really impressive. Definitely at peace of mind with the advancement. You've done it exactly the way I was hoping, So I appreciate it.
no, but that was after all the planning, right? You remember I told you we need a date to do the mock surgery, move it forwards, check, double check, and then go for the surgery. So yeah, that's okay. But this is important for you to understand. That's why I take time to tell you a little bit, even though I know I've kept you waiting too long to just before you were going to take the flight. But this stays with you because you know what's happening. And also because you know there are not so many implants, especially in the lower jaw, you need to give it some rest.
Right.
I don't want you chewing something hard or biting on some bones or stuff like that. Remember, bone takes 4 weeks to heal.
Okay.
So never try anything before that. Your upper jaw is probably more stable because I've used a lot more implants. The lower we've used just 2. It's enough. I don't want to put in too many plates and too many screws because that can cause problems by itself. And also the lower jaw is such that the nerve comes through it. So I like to put the implant lower to that so that we don't have any pressures on the nerve when I tighten the screws. But you've got to be a little careful in the immediate recovery. That's the only thing I think I should tell you to be careful. And this is one more thing. I'll show you another view of the panorama. This is probably the last one, a simple one to understand.
That's the frontal view, right?
Yeah, this is like the panorama we call it.
Why did that look like? Why did that
This was the way it was before we started, and this is now.
I mean, it looks way more symmetrical,
Yeah, it's
Yeah.
all right. So you have a safe journey back to UK.
Yeah, we'll do. Very
And
tight.
I know, because of the journey, because of the surgery, because of the recovery, because of less diet. So I want you to take good care of yourself. We have given you another number also on the discharge summary. And plus you have my number, I guess.
I do,
Yeah, so if there's anything you have to let us know. And I hope there's going to be no issues. But still you have to take good care.
Of course.
And you reach tomorrow around the same time?
On the 12th, 7:30 in the morning, so early morning.
Okay. And I remember you telling me about the couple of RT-PCRs. All are done and ready?
All done, ready
So,
to go.
okay, good.
All set, I'm ready. Yeah.
Perfect. So take care.
Yeah.
And if there's anything, let us know.
Will do. Thank you very much.
Pleasure, man.
Appreciate it. You're the best, man. Honestly, you are, man. There's
Thank you.
Nobody like you.
Thank
Nobody
you.
like you. I
Thanks.
came all the way from London for a reason, and I've been struggling to get my visa just to come and see you. I've been back and forth with
I know.
you via WhatsApp.
Because of
I lost
COVID.
hope almost, because I thought, what, pandemic came along now, maybe it's just destined, maybe I'm not meant to be. Maybe it's just not meant to be.
Yeah.
And then I tried one more time. I saw a London patient recently on a video, and I thought, hold on a second, I've been trying for 1 year, how did this guy come?
Yeah, he came in, but he was an Indian.
Was he?
He had an Indian passport, so he could come over. Yeah.
Got it.
That was
so
fun.
then I tried one more time, and they said, yeah, that's fine. Good to
Yeah,
go.
he could
Okay.
come over. Yeah, and I remember with you, especially on day 3 when I came for rounds, it's like there's no swelling.
Yeah.
It doesn't look like I've had a major procedure, so sorry. We're just going to clean that up first up. We just clean that and put a nice tape. All right, man.
All right.
Take care. We'll put a proper tape for that. Medicines la kurta cha. Okay.
Thanks a lot.
You're
Appreciate
welcome.
it once again, and I'll message you when I get back.
Sure.
Yeah.
Take care.
Man. All the best.
Angu karaway. Ha.